Thank you so much for trusting us with your oral surgery care. We really do appreciate it.
And we want to provide you with the highest level of care, and we hope to make your recovery after surgery as easy as possible.
In order to optimize your healing, we want to go over how to best take care of yourself after a surgical procedure. So let's talk medications.
So here's your prescription. There's the Percocet, amoxicillin.
We typically will have prescribed you several medications at your initial consultation appointment, so hopefully you've already picked these up. If you didn't receive your prescriptions yet, please be sure to let us know.
Your prescriptions will have clear instructions, but we'd like to give you some tips on how to take our most commonly prescribed medications. If you have any allergies or medical conditions that prevent you from following these recommendations, please take them into account.
None of us are big fans of pain, so make sure to stay ahead of it. Pain control is best achieved with a combination of over-the-counter Advil and Tylenol. These medications provide excellent baseline pain control by preventing pain and swelling. If needed, your prescription pain medication can be used as a backup to control breakthrough pain.
We recommend taking 3 standard 200 milligram Advil tabs and 1 500 milligram extra strength Tylenol tab regularly every 4 to 6 hours. Take your first dose before the numbing agent wears off so you can stay ahead of the pain. You should continue this schedule consistently for 4 to 5 days after surgery to prevent pain. Typically, pain peaks around the 2nd or 3rd day after the surgery, and this over-the-counter regimen works well for most people to adequately manage their pain.
If you find you need something stronger, the prescription pain tab can be taken with Advil, but not Tylenol. Try not to take the prescription pain pills on an empty stomach, as this may cause nausea. For our pediatric patients, please use the recommended dose on the bottle of children's Advil and Tylenol for your child's age and weight.
Let's move on to antibiotics and mouth rinse. The easiest way to time your antibiotics and mouth rinsing is around meals. If your antibiotic is to be taken 2 times a day, take a dose with breakfast and the other with dinner. If 3 times a day, take a dose with breakfast, lunch, and dinner. And if 4 times a day, take it with breakfast, lunch, dinner, and before bed. On the day of your procedure, you can take your first dose with your first meal after surgery.
To keep your surgical site clean, we will have you do mouth rinses 3 times a day. For most procedures, we recommend using an over-the-counter mouth rinse, such as Listerine or Scope, or warm salt water. Sometimes we may even give you a prescription mouth rinse. Don't start your mouth rinses until just before bed tonight after surgery, and be careful to rinse very gently the first time. Tomorrow, you may start doing more vigorous mouth rinses after breakfast, lunch, and dinner. When rinsing, swish a sufficient amount around your entire mouth for 1 minute. If you are given the prescription mouth rinse, try not to swish more than 3 times a day with it, as mild brown staining on the teeth and tongue can occur with overuse.
Some procedures can cause more significant pain and swelling, such as wisdom tooth removal and bone grafting for dental implants, so we may prescribe you a short anti-inflammatory steroid course. This helps to minimize your recovery by drastically reducing pain and swelling for these procedures. Inside the box that the prescription comes in is a foil package of pills. There are a specific number of pills to take for each day of the steroid course. You will want to take day 1 today after you get home, which is 6 pills. The easiest way to do this is to take all 6 pills at once, about an hour after you get home with a small meal. For each subsequent day, you can safely take the entire day's worth of tabs all at once with breakfast to simplify the dosing.
If you're going under IV anesthesia, or if you have a history of nausea with prescription pain pills, we'll likely have prescribed you some anti-nausea medication. Fortunately, we have almost no incidence of nausea with the IV anesthesia we perform, but occasionally the prescription pain medication can cause it. Should you have even slight nausea, take one of our anti-nausea tabs in order to prevent it from worsening. These can be taken every 6 hours as needed.
Okay, that's it. We hope you found these tips and instructions helpful. You'll be given a written version of these instructions for reference, and you can also find this video on our website for additional viewing.
And if you have any questions at all during your recovery, please don't hesitate to contact us by calling the main office.
We're available by phone 24 hours a day, and we're always here for you.
Thank you again for trusting us with your oral surgery care. We wish you a quick and easy recovery.